Hello and welcome, I'm Oles Garjuk and you're watching Head to Head with UATV. The first video course on the rights of people living with HIV has been launched in Ukraine. It is called Know Your Rights and it is a part of the Healthlink program which expands the availability of HIV testing. To talk more about this project and how can it help fight the HIV epidemic in Ukraine, we welcome to the studio Valeria Rachinska, Head of Regional Policy Team of 100% Life NGO. Hello and thank you for joining us today.
Hello.
It's a pleasure to have you here. But the statistics in Ukraine, as far as I read, is very troubling. Ukraine has the second largest HIV epidemic in Eastern Europe and Central Asia. So how many people living with HIV do we have here in our country?
Yes, you are quite right. We are number two.
Number two.
Yeah, after Russian Federation, actually. And we have like 19% of all Eastern European epidemic in our country. And
19%?
19, yes. All of newly detected cases, it's Ukraine. And officially registered, it's around 144,000 HIV positive people, but estimated data it's 240,000. That's why we can understand that 100,000 people
do not know their status.
Yes. And the most concerns in this situation that they can transmit HIV because they don't know their status.
Because they don't take care of themselves.
Of course, they don't know status, have unprotected sex, and they can transmit it to other people.
But how can we guess that there are roughly 250,000 HIV positive people in Ukraine if we know only about registered cases? How could we analyze this or research it?
We have a special unit in our Ministry of Health, monitoring and evaluation unit, and they have an ability to create this estimated data based on IBBS. It's some behavioral researches that take place each 2 years in this country. And they have special program, Spectrum, and put all data from newly detected cases, IBBS results, statistics from previous years. And this special program can create the result, how many cases we can expect in the future.
Are still not known yet. Okay.
Yeah.
So we are talking, well, I think that this project Healthlink is targeting this issue to give people more access to HIV testing. But so far, let's talk about Know Your Rights video course. Tell us what rights do people with HIV have and what rights are most often violated in Ukraine?
Especially Ukraine have a lot of cases of stigma and discrimination against HIV positive people because people don't know information. A lot of information still don't have this information, and a lot of people living with HIV, they represent not just HIV positive people, but gay populations, such as people who inject drugs or use drugs, sex workers, men who have sex with men, and transgender people. And among Ukrainian population, we still have a lot of stigma and discrimination for this
societies.
Yeah, for these societies, for these groups. And it's sometimes it's cross-sectionality because person can have HIV and at some moment inject drugs and do sex work and so on. That's why it's, of course, it's very important, and it's against stigma and discrimination and about to educate people to know their rights. And,
okay, so this video course targets people who were registered with HIV positive status, not people who just everyone else.
Targets of this course, it's pretty wide because it's not just about people living with HIV, but it's about this gay populations group, and it's for national police, for social workers, for human rights defenders, and for relatives of HIV positive people, and actually for all population of Ukraine, because all people living with HIV still live in society, and people around them have to know about their rights. And it's not just about the right to have health care. It's about economical rights, it's about social rights, it's about right to have protection from the government. It's about availability of community resources for them and so on, because people face not just health issues but a lot of other related issues. That's why it's important to educate everybody about this sensitive
issues, very important educational course. How has it been formed? I mean, what specialists were taking part to form some kind of plan that this course should follow and to provide some specialists with information?
The idea was to cover everything about human rights and rights HIV positive people. That's why the specialists that were involved in this process, it was specialists from Українська Healthlinka спілка. And,
Helsinki group, okay.
Yes, and specialists from Center of Civil Health. And of course, it was controlled by specialists from the network from 100% Life. That's why I think that this collaboration, it's have to be really, really cool. And we will provide information that will cover all needs for information about human rights, and maybe about possible violation human rights.
Yeah. But does it consist of some kind of series and different episodes, this kind of video course, or is it just one episode that tells all the rights?
It's it's a lot of
short series. Yes?
Short series, yes. It's a lot of interview. It's not just something that, this and that. Yes, it's interview with specialists. It's a lot of promotion. It's like a training course. And it's available online, on online platform, and it's available for free for everybody in this country.
This is great. Free to download and free to watch online.
Yes, definitely, yes.
Could you please tell us when did you launch it and what is the feedback so far?
We have no feedback yet because we just started with this course, and
so it was recently launched.
Yes, it was just appeared maybe last week. We had no feedback yet, but we expect for this feedback maybe to improve something, because we're the best specialists in this country about stigma and discrimination, about overcoming in a HIV context, and Українська Healthlinka спілка, it's one of the best our partners in this area, but we still need feedback from our local authorities, from government representative, from national police, because we want to improve. We want this course to be really very useful for everybody in this country and help to change people's life.
Well, another topic to focus our conversation on is this Healthlink project. So as far as I understand, you coordinate two of these projects, both of them, which is, Know Your Rights is a part of Healthlink. And yes. Healthlink is a broader project that targets basically this HIV, not only the educational aspect of being aware of HIV and how is it being transmitted or not being aware, but this is a broader issue to fight an epidemic in Ukraine. Could you tell us more about it?
Yes, and this project, Know Your Rights, it was established because we found the gaps. Because it's really very good and very great project, Healthlink, but the main problem was that 50% of HIV positive people that were tested in like a healthcare facilities, they disappeared. They
just went out.
Yes, they didn't start their treatment. It was out of the project. It wasn't. They weren't our clients. But that's why we started this Healthlink, because Healthlink can provide services from testing for registration and starting treatment. And in this situation, client cannot disappear, because he have psychosocial support from social worker, and one of the reasons why people prefer to disappear is because they don't know their rights. It's the main gap, the main barriers.
They don't know that they have a right to have a treatment for free.
To have a treatment for free, to have this kind of psychosocial support, that we have no criminalization of HIV in Ukraine. That some people still have thoughts that maybe they will be in jail because of their status. Yes.
This is shocking to me.
Yes, and because in some other countries, actually, it's an option.
For example?
In Iran. I can be wrong, but in some Middle
Eastern countries.
Yeah. It's still an option for HIV positive people. Even from Egypt, they have travel restriction. If you're HIV positive and you want to go to Egypt, they can make deportation for you, deport you.
But how do they know about your status then? It's not written in the passport.
They could find medications, for example, in the luggage.
So in case they find out, they can deny you an entry.
Yeah, and it's officially. And we still have like a travel restrictions list in the world, and it's 22 countries in this list. Yes, in 21st century, it's a non-communicable disease, HIV, but we still have it. And some people, they like making researches in internet and find all this travel restriction, criminalization, and a lot of barriers. And they prefer not to be registered, because if you are not registered, you are officially not HIV positive.
And this is insane.
Yeah. This is insane. That's why we created. It was one of the ideas for creation this project, because we know people to know their rights. We know we want to inform people that it's no stigma and discrimination anymore. And sometimes it happens, but we want to show them way to avoid it, and sometimes to punish people that making this stigmatization and discrimination.
Well, also, as far as I know, this Healthlink project, it makes this HIV testing more accessible, right? So just state medical facilities and medical workers in these facilities, they are being provided with this express HIV test, so they can perform it and to test as many people as possible. But are these medical workers, are they also educated how to behave in case they detect their patient to be HIV positive?
Of course, we have very well-educated staff, but you know, education is just one thing. That's it's not always not enough. Yes, that's why it's scarce for social workers too, and for all healthcare providers, including doctors, medical staff, because sometimes we have cases of stigma and discrimination through among medical staff, and this is a problem. That's why it's for everybody, and we do expect for great results.
Well, let's hope that we can discuss these positive and great, as you say, results very soon. So far, I thank you for this comments, interesting comments and valuable information.
Thank you.
That was Valeria Rachinska, Head of Regional Policy Team of 100% Life NGO. Thank you for watching Head to Head. I'm Oles Gardyuk. Goodbye.